1458. I'm afraid we're going to have to return to the issue of COVID, because it's obviously an issue that is gripping the nation following the announcements made this week by the Prime Minister. Joining me from North London is Dr. Luxmi Velauthar, who was born in Colombo in Sri Lanka and is now a leading consultant in OBS and Gynae at Bart's NHS Trust in central London. She is the lead for the fetal medicine unit at Newham Hospital. Her research interests are to deal with pre-eclampsia and preterm pregnancy. Her research interests are in blood pressure issues and preterm pregnancies. Her recent publication was on universal screening of COVID-19 in pregnancy. Newham Hospital is the very first NHS hospital in the UK to introduce this testing. She joins me this morning from North London. Good morning, Dr. Velauthar.
Good morning.
Now, do you agree with the new restrictions and the measures taken by the Prime Minister this week following the increase in the number of COVID-19 cases?
The aim of the government all along has been to reduce the viral transmission in order to save lives, protect the NHS and the most vulnerable. We need to understand that second wave is real and it may hit harder than before. Looking at the previous pandemic trends, the second wave is usually worse than the first. Although we feel that we appear prepared for the second wave, it is quite difficult to predict what's going to happen, especially when the winter is not so far away. And we know that only about a month ago, there were 1,000 positive cases. But with the current doubling rate in the past week, it is expected that the rise can be as high as 10,000. So with the restrictions that the government has put in place, we hope it will contain the virus and we hope it will save more lives.
What consequences do you think that this will have on people?
Obviously, isolation and the containment, especially the restriction on social gathering, it's like